And today I'm going to give my presentation about vaccinating your children. This is my audience. This is Raymond, Eric, Christian, and Peggy. Edward Jenner was a physician from England who developed the first vaccine in 1796 to Harvard Medical School. Jenner developed the smallpox vaccine, which has nearly eradicated the disease. Since then, several other vaccinations have been developed. Each vaccine comes with pros and cons, and some parents find it difficult making the decision whether or not to vaccinate their children. By a show of hands, who believes that vaccinating children should be done? For those of you who do not raise your hand or had to think twice about it, I'm here to tell you why it's important to vaccinate your kids. I will tell you why vaccinating is safer than not vaccinating. I'm going to tell you why it is financially better to vaccinate. I will also tell you some statistics that make the decision clear that vaccinating is the best option when it comes to the health of your children. As a parent, making sure your child is safe is the number one goal. Utilizing vaccines in one giant way, you can protect your children. In fact, the use of vaccines prevents up to 33,000 deaths each year, according to a 2003 study of researchers at the Pediatric Academic Society. Also, according to Harvard Medical School, vaccinations have been successful worldwide in lowering childhood deaths. Many diseases that were once common are now preventable due to vaccines. Another study in 2003 at the Pediatric Academic Society showed that childhood vaccines prevent 10.5 million cases of infectious diseases. Early childhood vaccinations protect your child from these diseases when they are the most vulnerable. It is true that some of the vaccines have some unpleasant side effects. These can be things such as fever, soreness, or a lump under the skin at the site of the injection, or rarely serious health effects. In the last 120 years, there have been a documented 30,000 cases of adverse reactions to vaccines. Of those, only 13% have had long-term effects. If you do the math, that is about 32 cases each year. Compare that to the number of kids that get vaccinated, and it is a very minute chance that your child will be adversely affected. With statistics like that, it can be said that vaccines are safe for your children. They are safer than the alternative, which is not vaccinating. According to several government sources quoted in Healthy Children e-magazine in 2012, there are currently vaccines against 16 deadly diseases. These diseases, if they don't kill you, can have terrible long-term side effects. Also, according to the Healthy Children magazine, vaccines are anywhere from 90 to 99% effective in preventing the disease. Also, if someone who's been vaccinated does get that disease, the symptoms are usually less severe. Before vaccinations are licensed and approved to use in the United States, the Food and Drug Administration reviews all aspects of the development of the vaccine. This includes where and how the vaccine was made. It also includes case studies that were conducted in people who received the vaccine. The FDA will not approve or give a license to a vaccine unless it meets standards of effectiveness and safety. The results of these studies also get reviewed by several organizations such as the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians. Each organization must approve the results of the studies and effectiveness before that vaccine is given a license to be used on children. Just as important are the booster shots, which are given throughout your life to continue to have immunity by building on the previous vaccine's effectiveness. Now I'm going to tell you why vaccination is important for not only your financial health, but also your country's financial health. According to Claire McCarthy, the faculty editor for Harvard Health Publishing, national health spending accounts for 17.89% of the gross domestic product. That is nearly $10,000 per person per year. This is expected to rise 5% each year through 2025. We need to do what we can to cut down on healthcare costs. Vaccination is number 1 on the list. According to the CDC, the cost of all vaccines children receive is about $1,200. This might sound like a lot, but the cost of doctor visits alone can add up to this very quickly, as I'm sure all of you are aware. One hospitalization will surpass this amount exponentially. Vaccinating prevents many hospitalizations that would be costly. One example is if a baby contracted rotavirus. The hospital bill to treat this potentially deadly disease would be anywhere from $3,000 to $5,000. If a child were to end up with a disability due to one of the preventable diseases, such as paralysis from polio or encephalitis caused by measles, the ongoing cost of those treatments could be very high. There are also costs that incur when a parent has to miss work to stay home with a sick child. According to the Bureau of Labor Statistics, the average hourly wage in the United States is $26 an hour. 26. This means each day missed due to a child sickness could cost $208 in lost wages. Insurance premiums are also on the rise. The more the insurance companies have to pay out, the higher the premiums for all of us. Prevention makes financial sense not only for you, but for the country as well. All in all, there are several reasons to vaccinate your child. I will just highlight some. Number 1, vaccines can save your child's life. Diseases that have killed thousands of children are now preventable thanks to the advances in medical science. This is just a no-brainer. Number 2, vaccines are safe and effective. I've already told you about the statistics of safety and effectiveness. It only makes sense. Number 3, vaccination protects others that you care about. Children can still get the disease after being vaccinated, but the likelihood of the disease spreading is much less if all children are protected against it. Number 4, as mentioned before, vaccinating saves money in the long run. Getting vaccinated is a good investment. And number 5, vaccinations protect future generations. Vaccines have reduced and eliminated many diseases. This could be from a pregnant woman not passing on a disease because she had been vaccinated, or also from completely eradication of a disease. Smallpox is one example of this. According to the National Department of Health and Human Services in an article on vaccines.gov, children are no longer vaccinated against smallpox because the disease has been eliminated through years of vaccinating. I have talked to you about the importance of vaccinating your children and making sure to stay up to date on the booster shots. I have talked to you about the safety of vaccinating, the effectiveness of it, and why it makes financial sense to have your children vaccinated. You now know more about why it is important to vaccinate your children. For those of you who did not raise your hand in the beginning, I hope you have a better understanding of the importance of vaccination. I implore all of you to spread my message that vaccinating is important. Okay, I'll wave.